Hello there and welcome to another video by me, Dr. Carlo Oller. Let me tell you a little bit about me. I'm a board-certified emergency physician with 18 years of experience. And this educational video, we're going to be talking about how to perform an ear irrigation utilizing specifically the elephant ear device. This video is intended for anyone brave enough to give this a try, but remember that ultimately this is a medical procedure and it is best performed by a medical professional. This is a general education video and should never replace the advice or treatment of your medical professional. So, you can purchase this elephant ear kit through the Amazon.com link on the description of this video. In doing so, you help support this video creator, myself, and in doing so, helps me make future educational videos. So let's start with what exactly is ear irrigation. Well, the irrigation of the ear is a routine procedure used to remove the following: excess earwax, also known as cerumen, and foreign materials from the ear. Having wax in your ear is a good thing. The ear naturally secretes wax to protect and lubricate the ear on the outside, as well as to keep debris out and hinder bacterial growth. Did you know cerumen is actually a bactericidal substance? Under normal conditions, the body keeps the amount of earwax and the ears under control. In fact, the ear canal has hairs in the hair cells inside of the ear canal, and these help move the wax and debris out of the ear. Too much earwax or hardened, compacted earwax can cause a blockage in the ear, resulting in earaches, ringing in your ears, even temporary hearing loss. So what is the purpose of irrigating the ear? The ear, specifically the canal and eardrum, are very sensitive. Earwax buildup can cause damage to these structures over time, and this can affect your hearing. Removing the excess earwax with ear irrigation is a safe way to minimize the risk of damage to the ear. Sometimes foreign materials like food and insects and small stones can get into the ear. In these cases, the goal is to safely and quickly remove the items before they move deeper into the ear or do damage to the delicate canal. Ear irrigation can be effective in removing foreign materials from the ear. Earwax irrigation can be done by your doctor or even at home using an ear irrigation kit like the one we're describing, the elephant ears. Now, know this, there are risks to ear irrigation. You must never undergo irrigation, either at home or at the doctor's office, if you have a damaged eardrum, if you have active tubes in your ears, or a condition that weakens your immune system that puts you at risk for infection. We'll talk about that in a little bit. You also should not get an irrigation if you have an active infection, as is Otitis Externa, infection of the ear canal. Also, if you have a history of middle ear disease, ear surgery, inner ear problems, specifically vertigo, as the process of irrigation will make this much worse, or if you've had radiation therapy to the area, those are additional reasons to choose another method of cerumen disimpaction and removal. So let's talk about the process itself. Before your doctor or anyone else performs an ear irrigation, they will want to look inside of your ear to ensure that your symptoms are the result of excess wax buildup or foreign materials and not due to something more serious like an ear infection, a tumor, or worse. Your doctor may diagnose excess earwax by inserting an instrument called an otoscope in the opening of your ear. The otoscope shines light into your ear and magnifies the image so they can make a proper diagnosis. If you haven't already, check out my video on the use of a Bluetooth otoscope that you can also purchase directly through Amazon, and it can links to your cell phone in order to perform an ear canal and tympanic membrane examination before you try to do an ear irrigation procedure. This device will let you see the image on your phone and diagnose your own problem, and like I said, to make sure that it's due to wax or foreign body and nothing worse. If wax buildup is confirmed to be the issue, your doctor will perform the irrigation using some kind of syringe-like tool or other device. This tool will be used to insert water or water and saline mixture into the ear to flush out the wax. You may feel slight discomfort from the water in your ear and from trying to hold the ear in place as we do the procedure. Preparation. Well, some providers may choose to soften the wax before irrigation. This is a great idea, but sometimes there's not much time in the emergency department versus an office. Multiple agents can be used, including mineral oil, 1% sodium doxysate, which is the same as Colace liquid used for constipation, but you put it in the ear, and peroxide solutions like water peroxide. You must apply the softening solution for at least 15 minutes prior to attempting the procedure, but the longer you leave it in place, the easier the procedure will be to perform, the easier and softer the wax will be, and it'll come out. Let's talk about the technique. You first ask the patient to lay down with the affected ear up. Place the ceruminolytic of choice, while we talk about the substances to soften that wax, in the external ear canal and leave it for 15 to 30 minutes. After that, you will ask the patient to sit up. You drop warm water into the elephant ear canister and attach the rubber catheter tip to the end of the blue hose. Place the rubber catheter into the external ear canal and you will notice a circular plastic shield-like structure. This has the purpose of two things: to shield the user from splashback of fluids and to serve as a stop to the depth at which you insert the rubber tip. You don't want to insert it too deep and cause injury to that tympanic membrane. You must hold the ear irrigation basin tightly to the skin below the ear in an attempt to catch all the water as it irrigates and comes out. This will help keep the patient from getting soaked. Direct the rubber catheter upwards and backwards in the ear canal so that the water will separate the cerumen from the tympanic membrane and the canal. Do not direct the water stream directly at the tympanic membrane. In other words, don't direct straight into the canal, but rather like a little bit of an angle so the water can splash through, may create turbulence and dislodge the cerumen wax. Do not inject too rapidly or forcefully, as this will create too much pressure and result trauma to the tympanic membrane or external ear canal, bleeding, and pain. During the irrigation, you can stop and re-examine the canal. Sometimes the wax has moved enough that now you can use an object to remove the loose pieces of wax with either a cerumen scoop or even alligator forceps. You must be very careful not to damage the external auditory canal by scratching it or to go too deep and damage the tympanic membrane. To dry the remaining moisture out of the external ear canal, apply several drops of isopropyl alcohol. This step must be contraindicated, means don't do it if the tympanic membrane is ruptured. That alcohol will go in and damage your tympanic membrane, your inner ear, the nerves, etc. Following a prolonged irrigation, topical steroid-containing suspension drops such as ciprofloxacin dexamethasone drops is an anabolic steroid drop, may be soothing to external auditory canal and will prevent you from getting an infection, because now that we have disturbed the normal oils, the normal skin, and maybe there's microabrasions that can result in infection settling in. Many providers prescribe antibiotic drops to patients at high risk of severe infections, such as diabetic patients. These drops are usually prescribed for several days following the irrigation procedure to prevent the complication of otitis externa. Sometimes a person may have to repeat this procedure 5 times or more to notice the earwax breaking free. If they attempt the process 5 times without results, stop what you're doing and talk to your doctor about other options. Maybe what you need to do is go home and apply these ceruminolytic solutions twice a day for a couple of days. Come back and try again. While ear irrigation is a relatively common procedure, but there are risks, and we've already talked about some of that. One of the most common is ear infection of the external ear. Is very common. This is an inflammation of the ear canal that could be caused by infection, and it becomes painful. It can be extremely bad if you're diabetic or have any other illness that predisposes you to infection. Another potential complications is ear infection, otitis media itself, like where your kids get an ear infection, which is an inflammation of the middle ear. Ear infections are one of the most common complications of irrigation, both inner ear and external ear canal. But also another complication is perforated eardrums. In some cases, ear irrigation will press against the wax and make it more compacted because you're pushing straight into it. This makes it harder to remove and puts more pressure onto the eardrum, increasing the risk of perforation. In some cases, fluids become trapped in the ear canal, and this causes increasing pressure that can rupture the eardrum. Other complications, although more rare, are vertigo, which is the sensation of the room spinning in circles around you. This is usually temporary. Deafness, which can be temporary or even permanent. Since earwax buildup can be harmful over time or be the result of other health conditions, see your doctor if your symptoms aren't improving after home care. They may want to try other methods or send you to an ear specialist. Those who are using hearing aids are especially prone to having earwax buildup. Side effects are typically short-lived and go away within a day or so. If you experience pain or discomfort that gets worse instead of better, or you have any other symptoms like fever, chills, severe pain, warm or red discoloration of the ear on the outside or the area just behind the ear, the mastoid, you should seek medical attention as soon as possible. Here's a very important message. Cotton tip swabs, Q-tips, should not be inserted into the ear canal. These are known to push the wax against the eardrum and the ear canal. I know this might just sound silly after I've just instructed you and give you details on how to perform this medical procedure, but in general, you or your family should not insert anything bigger than your thumb into the ear canal. Remember, wax is healthy and the body has its own mechanism for removing wax on its own. I want to thank you for watching this video, and I hope that the information that was presented here was of extreme value to you. You can find other videos like this at drer.tv and on PatientEducation.Video. We'll see you in our next video. Bye-bye.